mentioned just a moment ago. What does NMHI do? What's your main purpose?
So the Nutrition and Metabolic Health Initiative is a clinical research facility that is home to many faculty, 5 from nutritional sciences, and campus-wide if people need to use the facility to do their clinical research studies in areas around obesity, metabolic disease, health and wellness, and that sort of thing. We also provide clinical services to the community, and in weight management, nutrition counseling for various things. If you have diabetes, hypertension, or even if you're just somebody that wants to be more healthy, we provide that kind of guidance. And we have a strong expertise in obesity management through a lot of different types of programs that we can offer to people. And our other mission is to train students and do community outreach. So we spend a lot of time. We have over 25 students here that are engaged in everything we do. They work with our patients and they also are involved with our research subjects. We recently had our first high school training program. We invited a small number of high school students from the community to come and learn about everything that we do here. It was a week-long event that's going to continue. Actually next year more formally and large scale. So we really want to reach out and help the health of the Lubbock community.
When you talk about the health of the Lubbock community, it seems like we are more aware of having a healthy lifestyle than we've been in the past. Would you agree with that? Are we starting to at least try harder than we've done?
I think people have been trying for a very long time, and there's a lot of not so ideal information out there about what to do and what not to do and so forth. I think what's improved in recent years is the expert knowledge that's more reputable and a bit of a reduction. It's never going to go away, but in some of the snake oil kind of approaches to health, wellness, and lifestyle. We work on it through, myself and my colleagues have been working for years to improve the messages that are out there, to work with industry, like the food industry, to try and help with some of the marketing aspects of food and exercise, to get a better, more balanced message out there.
Well, let's talk about the balance. You mentioned nutrition, you mentioned exercise. You need a balance of both in what you would promote as healthy living. You need both?
Our approach is an overall whole person approach. We tend to call it a healthy lifestyle approach to weight management, disease management, and so forth. Good nutrition, good physical activity is good for people. It doesn't cure everything. So obesity is an example. Obesity is a metabolic disease, and people's bodies change as they gain body fat in a way that makes it pretty much impossible for some to be able to just eat better, exercise better, and have the results they need. So there are medicines, there are various ways. So we take a very medical approach, looking at the person's physiology, their mental orientation to wellness, how they manage stress, how they cope with life, how life copes with them. We look at their whole life and see how we can help them to make healthy eating, exercise, good self-care part of their life, and have reasonable expectations about the impact that'll have.
So you've got two aspects there. You've got the mental part, you've got the physical part. And mental is oftentimes overriding the physical, right? Or not overriding it, but it's a huge part, isn't it?
It's interesting in the word, the mental that I used, it's again, that's a complex interaction between us and the world. And we've, actually one of my primary research lines here has been looking at how the brain responds to both the environmental food cues and the hormones that come from our gut and influence whether we're going to choose to eat, whether we're going to have cravings. So we do neuroimaging, we take pictures of people's brains, we draw blood, we're trying to understand how those things interact. So again, the food environment's important in whether you're going to eat or not eat, and how healthfully you will do that, and all of those things out there influence it. But unless we understand how that interfaces with the physical body, we're not going to ever overcome this world of food.
Right, right. Now, take me on a little bit of a tour. Tell me the different rooms you have behind us here.
Yeah.
So you mentioned blood work. You do blood work. You looked at physical part. Well, just go through the different rooms you have.
Yeah, we have a room, well, we have a couple of rooms devoted to being able to draw blood and process blood. So we can do our own blood analysis on a lot of different things. For some of those studies I just mentioned, we're measuring hormone levels in the blood that influence whether somebody feels full when they eat or when they feel hungry, and how those respond to eating, how those respond to cues in the world, and so forth. We just did a study where we had people come in, we scanned their brain in the morning, we fed them, we took their hormones all day, we scanned them again and took their hormones at the end of the day, and we're in the middle of sort of publishing that work. Yes, taking blood and processing our own samples and analyzing them both here and on the main campus. We have some of this, the most accurate ways to measure metabolism here. There's the metabolic cart, which basically measures how your body exchanges oxygen and carbon dioxide in a way that tells us how many calories somebody needs when they're at rest. And so when somebody comes in for studies or for clinical work, we can tell pretty much what their body needs. And that's helpful in setting, various calorie goals. Everybody's quite different. We can see how metabolism changes in response to doing healthy lifestyle and diet and exercise and so forth. We have body composition equipment. We have the gold standard in measuring body composition, which is called DEXA. It allows us to measure muscle, fat, bone, connective tissue, and we can look at individual parts of the body with it. It's the machine that all others are compared to, and we have some of the machines that are compared to it. We pretty much have, for metabolism and body composition, all of the different methods that you use in a clinical setting to measure those things. And when people worry that they're gaining too much muscle because they're exercising, which takes a lot of work to gain muscle.
Yeah, I've never had that.
Yeah, me neither. But we like to see people, if you do a complete lifestyle approach to weight management, you will see a nice balance of lean and fat loss. So that people lose overall, they're losing a much bigger percentage of fat versus muscle and so forth.
Wow, there's a lot to it. Now, one thing you mentioned, Doctor, I just wanted you to expand on it a little bit. Each body is different. People don't come in here and you say, okay, here's the amount of calories you need, here's what you need to do. I mean, you do a great job of seeing the individual needs, which vary just as much as individual looks, right?
Very, very personalized. And a great example would be as people gain body fat. Body fat is basically an endocrine organ. It's a hormone generating organ in the body that influences how somebody's metabolism how they'll utilize calories. It influences how much they're going to want to eat or how full they feel. Those hunger and fullness hormones I'm talking about change when somebody gains body fat. So the idea that every time I diet and lose weight, it seems to get harder if I regain the weight is really accurate, because physiologically, when somebody loses body fat, their hormones don't adjust quite the same as they would otherwise. And the best way to put it would be that somebody that has lost body fat and then regains it stays more hungry, physiologically, hormonally, and so forth.
Okay, wow. This is really interesting to me. Now, this next question is kind of selfish. Is there as we get older, we gain weight. So is it harder to lose weight or to manage your weight as you get older because of all the habits you gained, or how do you answer a weight age question?
Metabolism does slow as we age, but there are many other things that change. So the amount that metabolism slows down doesn't account for all of the age-related weight gain. We also get busier. We get maybe less inclined to move as much and so forth. And so it's really the combination of how our lifestyles are affected, how our hormones and our overall metabolism changes with age, and even just the broader factors like, do we have enough time, do we prioritize it, and so forth. It's not an inevitable downward decline. Think about it that way. We can certainly work to help people at all ages. In fact, our average person is 55, 45 to 55 years old that seeks weight management. There are more challenges for women as they age that we're aware of with menopause and so forth, because again, those change your body in ways that make it harder to manage weight. We have less research about those changes in men. The ones in women are more obvious, but there are people looking at how men's metabolic functioning changes over time also.
I think the exciting part is we're continuing to learn. We're getting better. We've still got more to learn, don't we?
Yeah, we've been doing this I've been doing this for many years, and we learn more and more every year about how the body responds to dietary interventions, how the body's metabolism is influenced by our lifestyle and so forth. But one of the messages that we try to send, whether you're trying to just be a little more healthy, weight management isn't the only reason that we exist. We do a lot of work with people just trying to have healthier lifestyles. The message is that, yes, your personal motivation is part of it. That's why we do health coaching. But what we do with our health coaching aspects of all of our programs is more about helping people identify how the world gets in their way. Your work life, your social life, your stress management, how you cope with emotions, all of those things influence your ability to commit to health. And people think that it's personal shortcomings. Like, if I was a better person, I would eat better and exercise, and if I knew more. But really, it's about how do you implement. You can make a difference in your health by eating better, exercising better, managing your overall lifestyle. You're still working against a body that sometimes isn't helping. And so we take too much blame, and in obesity, people are blamed for having it. And they get different types of care in healthcare settings than a person that appears to have a more normal weight range. And we work very hard to help people understand that a person that appears to have excess weight might be working just as hard as you are. Their body is just not quite working in the same way, and that's what we see a lot. And we also advise people on other options. So there are 5 or 6 FDA-approved medicines that work very well. We work with some of them in our research studies that help kind of reset some of the biological uphill battle that people, because of the fat gain. We also we work with bariatric surgeons, because for some people that is the right choice. No amount of willpower or no amount of, they need the metabolic bump that they get from bariatric surgery, and it's a very effective tool. We work directly with some of the surgeons in the community to better understand that approach.
Perfect. Man, this is so good.